Assalamu alaikum everyone. Welcome to my YouTube channel MediBuild Pro. I hope you guys will be fine and doing great and enjoying your good lives. So congratulations to all of you, especially my USA viewers who were basically requesting, sir, can you please start a series where we can just have all lectures in English language. Yes, so I am just going to start a 20 lectures roadmap. So this will be our fundamentals, like we will be just discussing the basic kind of a stuff in this one to advance as well. So this is complete going to be in English language. Okay, so these will be containing, like basically this course will be containing 20 lectures. Okay, so this is a medical billing course series in English language complete. So let's see what kind of a different lectures do we have in this basic course, and inshallah we will start our this course soon. Let's see what kind of a different lectures do we have in this basic course. Here we go. Okay, so as you guys can see that the first lecture will be on introduction to US medical billing, like what is medical billing, what are the different steps which we have in medical billing, and what is RCM, like revenue cycle management. We will be discussing all that kind of stuff in the first lecture. Our second lecture will be on understanding the US healthcare system and insurance types, like what are the different insurance types, like Medicare, Medicaid, like federal insurances, private insurances, commercial plans, what are the PPO, HMO plans, and all different kind of stuff. So we will be discussing all that in that lecture number 2, and we are just going to have the lecture number 3, that is patient registration and demographics. Like we will see that how we are going to basically register the patients, what kind of a different data do we need to add in our system or in our medical billing softwares, and what is basically a patient's demographics, what kind of a basic documentations or basic data which we need to enter into our claim. So what kind of things basically we require, like the patient name, date of birth, social security numbers, address, gender, and all that kind of a stuff. So we will see all that kind of a stuff in our lecture number 3. And in our lecture number 4, we will be just visiting eligibility and benefits verification. Yes, how we need to verify the patient's eligibility, like if the patient is active on date of service with different kind of insurance or not. So, and we will also verify the patient's benefit as well. What are the different methods, what are the different tools through which we can just find out the patient's eligibility. So all that kind of a stuff will be discussed in lecture number 4. In lecture number 5, we will see that pre-authorization and referral requirements. Like what is basically pre-authorization, retro authorizations, and where we need the referral requirements as well. So basically there are a few certain services where we need to get the prior authorizations or pre-authorizations number to add all that kind of stuff in our claim, so insurance can adjudicate that claim and process that one. So we will just look all that kind of stuff in lecture number 5. And in our lecture number 6, we will be just going through introduction to CPD, current procedural terminology, ICD, International Classification of Diseases, and HCPCS coding or Healthcare Common Procedure Coding System. So we will discuss all that kind of a stuff in that lecture number 6. So we will be having the basic kind of a stuff, like what are the CPTs and how we are basically just going to translate a code, different kind of procedures into CPTs and different kind of a diagnosis into ICDs, and what are the differences between CPT, ICD, and HCPCS codes. So we will be just discussing all that kind of stuff in our lecture number 6. So let's see what we have in our lecture number 7. So in our lecture number 7, we will be just discussing modifiers in medical billing. Like what are the different types of modifiers, what are the common used modifiers. Okay, so what are basically these modifiers? We will be just having a quick overview of these kind of modifiers in our lecture number 7. In our lecture number 8, we will be just discussing CMS 1500 form line by line breakdown. We will be just seeing that what are the different two segments, like two sections of this one, and what kind of a stuff is included in these forms, and how we are going to basically add the patient's data into that kind of a specific form, and how we are just going to send that claim to different kind of insurance companies. And what is the difference between CMS 1500 form or CMS 1450 or UB04 form. Okay, institutional and professional claims, what are the differences between these two as well. So we will be discussing all that kind of a stuff in our lecture number 8. Lecture number 9, submitting claims, electronic data interchange, clearinghouses and portals. So we will see that how basically we submit the claims to different insurances, how we are just going to transferring our, basically we are using the electronic data interchange, and what are the different functions of clearinghouses, what are these basically clearinghouses. and we will be just using different kind of portals as well. So we will be sharing the screen, and we'll be having different kind of like you guys can say that different kind of portals through which we can just submit the claims and all that kind of a stuff in our lecture number 9. In our lecture number 10, we will be using billing software basics. We will just navigate to different kind of a softwares. We will be just having like what are these softwares, how they basically look like, and how we can just navigate to different kind of functions of these softwares, and what are the best softwares which are being used in medical billing nowadays. So we will discuss all that kind of a stuff in our lecture number 10. In lecture number 11, we will be just discussing Introduction to ERA, Electronic Remittance Advice, EOB, Explanation of Benefits, and Payment Posting. Like what are these ERA, EOB, what is the difference between ERA and EOB, what are the different stuff which we need to interpret when insurance is going to provide us different ERAs and EOBs, and how we are just going to do the payment posting. Okay, so we will be just discussing all that kind of stuff in our lecture number 11. Next lecture will be on common claim denials and how to resolve them. Yes, what are the common claim denials? Like what kind of a denials we are just going to have in a common way, and how we basically what kind of steps do we need to take, do we need to do to resolve all those kind of a problems or all those kind of a claims, and how we are just going to resubmit those claims after fixing that kind of a or rectifying that kind of errors. So we will be just discussing this kind of a stuff in lecture number 12. In lecture number 13, secondary billing and coordination of benefits. Yes, if patient has multiple insurance companies and we have just got the payment from primary insurance, then how we are going to deal with that kind of a secondary insurance, how we are going to send a crossover claim, and how we are just going to send the claim to secondary insurance, and how we are just going to get the payments. Okay, and how we can just differentiate between primary payers, secondary payer, and tertiary payers as well. Okay, so we will be just discussing all that kind of stuff in lecture number 13. Lecture number 14 will be on appeals and reconsiderations. Yes, where we need, like if an insurance company has denied our claim and they're not going to pay for the services, then we need to see that what kind of a denial reason do we have at that time, and if there is a necessary kind of a stuff that we need to do, that is going to be the send the appeals or reconsiderations. So how we are just going to send the appeals to different kind of insurance companies, and how we just submit the reconsiderations through different kind of portals. So we will be just having this kind of all stuff in our real time stuff. Okay, so we will see all that kind of stuff in our lecture number 14. So let's see what we have in our lecture number 15. Yes, specialty billing, mental health, dental, telehealth. So we will be just seeing the differences between mental health, medical billing, dental billing, and telehealth. So what are the basic differences between these 3 to 4 kind of a different niches, and we will be just discussing all that kind of a stuff in our lecture number 15. So lecture number 16 will be covering Medicare billing rules and compliance. Okay, so what are the basic Medicare billing rules, and what are the different kind of a compliance rules and regulations and laws, especially the HIPAA laws. So how we are just going to tackle all that kind of a stuff in our lecture number 16. Lecture number 17 will be on HIPAA, Health Insurance Portability and Accountability Act, PHI, patient's health information, and medical billing compliance. So how we are just going to make the patient's data confidential, how we are going to secure that kind of all stuff, and how we are just going to follow the rules and regulations of HIPAA compliance. So we will see all that kind of stuff in our lecture number 17. So our lecture number 18 will be on starting a medical billing business from home. Yes, most of the people just ask me this question, sir. I just want to start a medical billing company from Pakistan, from USA, or from other countries. Then how I can just basically navigate to different kind of rules and regulations and licenses and all that kind of a stuff. So we will be just discussing all that kind of a stuff, that how you can basically start a medical billing company from home, and what kind of things do you require at that specific time, what are the different prices models, okay, so which you can just offer your different clients. So we will start this kind of a stuff in our lecture number 18. So that is quite important lecture for all of you. Next lecture will be on lecture number 19. So we will just see that resume writing and job search for medical billing. Yes, this is quite an important for all freshers. So if you are looking to get different kind of skills in medical billing, then how you can just navigate to different kind of a resume, like what kind of a stuff do you need to add in all that kind of a resumes or cover letters, and how you can just find, and what are the different job boards or job portals where you guys can just find different kind of a medical billing jobs. So we will discuss all that kind of stuff in our lecture number 19. Last but not least, our lecture will be on medical billing interview preparations. Yes, this is quite an important kind of a stuff, like whenever you are just going to prepare different kind of a skills in medical billing and you want to appear in an interview, then what kind of a steps do you need to take? What kind of a things do you have in your mind at that time of your interview? So what kind of a stuff do you need to remind and do you need to memorize? So all that kind of a stuff we will discuss in our lecture number 20. So these will be the 20 lecture series. So we are just going to start this series very soon. So I'm just going to announce this one. So hopefully our first lecture will be uploaded in next week. So stay tuned. And if you have not subscribed my YouTube channel, then you can just do this one to get more updates regarding different kind of a jobs, different kind of a skills, different kind of medical billing lectures, and all that kind of a stuff. So this was all about today's introductory lecture that we are just going to start this kind of a series very soon. So thank you so much for your attention. If you have any queries, questions in your mind, then you can just WhatsApp me as well. My WhatsApp number is on the screen. You can also email me as well. So inshallah, we'll meet in our next lecture with different kind of a stuff in medical billing. Till then, take care of yourself and of your family. Goodbye. Allah Hafiz.